COVID-19 headlines to dissect, and to help us sort through it all is Dr. Robert Finberg from UMass Medical School. Doctor, thank you so much for joining us again. It's good to see you.
Thank you. Good to see you.
In the next couple of weeks, Governor Baker is saying that all schools in the state will have access to this pool testing that will help quickly identify positive cases and avoid outbreaks. Please tell us how this works and what advantages you think this might offer.
Pool testing means you take samples from several different individuals and put them together, pool them into one test. You might take samples from each pupil in a classroom, put them all together, and then if that test is negative, you can clear the entire classroom. On the other hand, if the test is positive, you would have to go back and figure out who in that classroom is positive. Pool testing works very well if there are very few positives, because you can clear people more rapidly and much less expensively.
Dr. President-elect Biden is expected to release all available vaccine doses once he is in office, which is on January 20th, with the goal of speeding up delivery. Right now, the current administration is holding back some of the supply to guarantee that people get the second shot. Slightly different strategy. Is there a danger or an advantage to either strategy?
Yes, there's dangers and advantages to both. The danger would be that the studies that have been done are based on getting 2 doses. So the danger would be that if you gave all available vaccine out now, some people might not get the second dose. On the other hand, I'm confident, based on the choices the incoming administration has made, that they will consider expert advice and do the right thing.
The Pfizer vaccine doses, Doctor, they're supposed to be given about 21 days apart, but there's a group that advises the WHO who's saying that it can now be delayed for as much as 6 weeks. So what can you tell us about that? And would accepting a delay like that require new government approval?
No, I think that we would all agree with that. This current CDC guidelines do not have a maximum delay between the first and second dose. So that would be, under the current guidelines, would be fine.
Doctor, we've been sharing numbers, obviously, in the wake of the holidays and New Year's, and the numbers have been rising. So here's the question. Since Worcester is such a large city, could you give us an idea of how things are going in the Worcester area in terms of trends, hospitalizations, and is there anything that's particularly concerning to you tonight?
Hospitalizations have gone up in the Worcester area, like in many places. We have over 200 patients hospitalized with COVID-19 in our medical center, as well as an additional 54 at the DCU Field Hospital. And we're concerned about a post-holiday surge, and we're continuing to monitor that. On the other hand, we've been very successful. We've vaccinated about 7,000 of our workforce so far, and we're working very closely with the state.
Just out of curiosity, have you been vaccinated yet?
I was in the Moderna trial, and I've been vaccinated.
You've been vaccinated. Very good.
And you feel okay? No effects?
No effects. It went very well, and I strongly recommend people get this vaccine. Anyone who's qualified should certainly get it.
Dr. Finberg, it's great to have you with us. Thank you so much.
Thank you, Doctor.
Have a great weekend.
Be
Thanks
well.
for your time.